I'm a general orthopedic surgeon, so I take care of most general kinds of common things, especially hip, knee, ankle, shoulder problems. And we take care of arthritis, hip and knee arthritis. And we do all different kinds of treatments, whether it's simpler treatments, injections, all the way up through surgery, just depending on what exactly is the best sort of treatment.
Well, I think one of the newer techniques in orthopedic surgery, especially for joint replacements, is we're doing things more specialized or patient-specific. We use computerized navigation during knee replacement surgery that really allows us to line up the knee replacement according to the patient. It maps the patient's hip, their knee, their ankle. So when I put a knee replacement in, it centers it specifically for that patient.
My leg just got worse and worse. He said, well, you know, he said, we're giving it shots, but I think the only thing, and you consider this now, is an operation, a total knee replacement.
When I came in the next day after the game, my knee was really swollen and it hurted really bad. So when Dr. Hughes came, he gave me all these examinations, but like when he told me to get up and walk, I would do it easily and he was confused. So he told me to come to the center, get an MRI and get a scan on my knee to see what happened. When he showed me the pictures, I didn't think it was that bad, and it was pretty bad. It was an injury that you don't see very often because it came out the root of the bone. So after that, he said, I'm gonna need surgery, and he really focused on after football, like when I get older. And that was really touching to me because he was looking out for my best interest later on in life. So he gave me an option of repairing it or just carving it out. Because when you hear meniscus tear, usually they just carve it out and call it a day, put you back on the field 2 weeks later. Well, he gave me an option. He said, we'll try to repair it, and if not, I'll just have to like carve it out. So when we went into surgery, he actually repaired it. But he didn't know the chances of me actually being able to repair it.
Well, I've been together with Dr. Simmons for a good long while, and Dr. Morton for a few years, and so they do some things that are a little different. They do some hip replacements that are a little bit better for younger people, and then they have some different techniques with computer-aided navigation or custom-specific jigs that are helpful, certainly, and I've occasionally had a patient that's the best thing for, and so I've sent them to see Dr. Morton or Dr. Simmons because their special interest is more appropriate for that patient.
After I had the nerve conduction test and had that situation under control, then I went back to Dr. Weimer, had the rotator cuff surgery, and that was successful. I did the physical therapy, I've returned to work, so everything is fine. But it was really great having those two doctors coordinating my care. I could get both situations taken care of. You know, they were able to communicate pretty quickly, get the ball rolling, so I didn't feel like I was waiting for, you know, this doctor to send things to that doctor. Everything happened very quickly.
From my perspective, it's nice just because all your colleagues that you deal with on a regular basis are held in the same building. So we can certainly work with the sports medicine guys. Not all hip pain ends up being orthopedic. It can be neurosurgical. It could be just pain management. And so we can have not only a multimodal approach to treating it, but a multi-specialty approach at trying to take care of the patient's needs, all under one roof. So kind of like one-stop shopping.
The center itself is great too. The nurses, the anesthesiologists, all of them, they were great. They were nice, very generous. If someone asked me about Dr. Hughes, I would definitely recommend him to Dr. Hughes. For the simple fact, when I thanked him so many times at the last game, he was like, anyone could have did this, any surgeon could have. I looked at him like, yeah, probably, but not the way you did it. For the simple fact, you don't see my injury too often at all. So I would definitely recommend anybody. I'm from St. Louis. I would recommend anybody to go to Dr. Hughes.